Hi everyone, welcome to Dr. Sharma Show. I'm your host, Dr. Sharma. I'm double board certified in nephrology and metabolic health expert. If you're looking for some health tips, you are at the right place. I am very excited today because we have a very special guest, Dr. Sanjay Bhojraj. He is the interventional cardiologist and functional medicine advocate, an educator at Institute for FX Med and owner of Laguna Institute. So I want to welcome him today.
Hey.
I'm very excited to have you here today, Sanjay. And how's the weather in California?
It's gorgeous, always here. You're in Michigan, where I did a bunch of my training, and so I know over there it's probably chilly. Here this morning it's 74 degrees and sunny. Southern California.
I'm jealous because it's very cold here. It's not actually too bad as compared to the last weekend. We had in 20s last weekend, and this weekend is 40s, which I can take.
It's a 20-degree swing. That's running outside in shorts and t-shirts. I remember when I was growing up, that would be a warm day.
That is true. All right. So, thank you for joining me today. You probably have a lot of other things to do on Sunday afternoon, but I appreciate you being here for our audience. Let's get started. So your background is interventional cardiology, and you are also functional medicine advocate.
Correct. Yes.
Tell us more about your background, your transition.
Absolutely. Yeah, so I actually did my training at Henry Ford Hospital right in your backyard in Michigan, and I was an interventional cardiologist, and I loved it. For those of you who don't know, interventional cardiology is a type of cardiologist that does procedural work. So I kind of joke, the doctor that you never wanted to see, because that would generally mean at 2 a.m. you came in the heart or into the emergency department with chest pain, heaviness, pressure, whatever it would be, due to a blockage in one of your heart arteries. So I would go in there through either the leg or the wrist with a catheter and open up the blood vessel and, save lives, which was great. And it was wonderful as a career because you do feel this immediate, gratification, and you're really helping people and you're helping them live. But then as time went on, as I got kind of 10, 15 years into my career, I was like, why do I have patients that keep coming back? Right? In the conventional medicine world, focus on mainly 3 things, right? Blood pressure, blood sugar, and cholesterol, right? So for those of you who have ever had a cardiac issue, or if you are fortunate enough to have a cardiologist, they're always looking at those kind of metrics. But I had a not small set of patients who, despite those numbers being under adequate control, still had cardiovascular events. In fact, I had one patient who every year for like 3 or 4 years, right around December 23rd, 20th to 23rd, right around just before Christmas, would come with a cardiac event. And I said, something is missing here. Something is not right. This isn't supposed to be happening this way. And through a set of backward circumstances, I found functional medicine and really liked what it had to say, because now instead of just focusing on numbers, we're focusing on the entire milieu of the patient, what's going on, the root cause, right? Focusing on diet, lifestyle, all these are the things that in the conventional medicine world, we just don't focus on. And then about, I'd say a little over a year ago, I left my conventional interventional practice and have really been focusing on developing programs online for people to help optimize their health through diet and lifestyle. And I'll tell you, Dr. Sharma, it is just one of the funniest things, because for as many stents and hearts and lives and all that stuff that I've felt that I've done well with, I never felt like it had as much impact as I do with kind of what I'm doing with functional medicine, because it's not just treating one event, it's preventing 1,000 other events, right? And that's such a big deal.
Yeah, I can relate to your story, and that was exactly why I went into functional medicine as well. So we both had that struggle of finding the answers which conventional medicine couldn't provide to our patients. And we have seen those patients, and these heart patients, kidney patients, they are very complex patients. They keep progressing. And I had the same question, why they are progressing into their kidney disease, why are they ending up into dialysis? And having 2 of my family members go through dialysis, I have seen it very closely. So that was really something which I wanted to explore, and functional medicine has those answers for those loopholes which we have in the conventional. So thank you for sharing that. And how long have you been practicing functional approach into your practice?
Yeah, well, I first was introduced in probably about 2017 to functional medicine, as you mentioned, through the Institute for Functional Medicine, through IFM. And, for any functional medicine practitioners that are out there, it is overwhelming, right? When you do the first course, you're like, oh my gosh, where do I start? So luckily, as a heart specialist and kind of metabolic specialist, I got to focus only on that one area of cardiometabolics. And so I slowly began rolling that out in my practice. I remember the first time I saw, that Monday morning after the conference, I saw someone that came in, I'm 30 years old. My dad had a heart attack at 50. What do I need to do? And I started talking about diet and lifestyle changes with him. And he got completely confused because he said, I thought you were just going to put me on a cholesterol medicine. Like, what are we talking about diet and lifestyle for? And I think that was when I realized what a disconnect there is, not just in the medicine world, but also from the patient's expectations. Because for so long, conventional medicine has not focused on diet and lifestyle, right? It's just not part of our training. I don't know about you, but I think I maybe had half of a lecture on nutrition in my medical school. And that was even a very biochemistry kind of centric, a protein has this many kilocalories per gram, and a fat has this many kilocalories per gram. Alcohol is this, it was a very kind of chemistry approach. But in terms of being able to provide material and impactful advice to patients on diet and lifestyle, we didn't really get any of that in medicine. And if you think about it, it makes sense because in medicine, we are just taught to treat, right? Oh,
Right.
This problem equals that medicine. It's a series of nested if-then statements. And then what question do you ask to get the information? And to the point that even most conventional docs don't know what to do. And if you don't know what to do, you're not going to suggest something that has happened, right? So
Right.
I've been kind of a fitness junkie. I used to do triathlons, and right now I'm a power lifter and all these different things. And there's a study that showed that physicians who are more aware of their health and exercise more actually suggest that more often to their patients, right? Not just being an oracle of wisdom for your patients, but actually modeling a healthy lifestyle
Exactly.
yourself becomes so important. And when I do, medicine, it's very difficult with the time constraints and all these things to focus on your own health, to find exercise. You're trying to take care of your kids and balance phone calls and charting and all these different things. But as doctors, as conventionally trained docs, and the both of us, are kind of the conventional trained and also kind of the functional medicine. So I think we're very important in this equation. But you have to have an awareness of all the treatment options available and really experience understanding how much leverage you can get and how much healing you can get from simple diet and lifestyle modifications.
Yeah. There was a saying that biggest threat to healthcare is health, right?
Yeah.
So if as a conventional doctors, if we start prescribing exercise program or nutrition, and that will actually help patients from healing their gut to their hormones to even impacting their genetics. Eventually your environment, your lifestyle impacts your genes. And that is so impactful. And we never
Yeah.
realized that. We haven't read about it in medical school, as you mentioned, nothing in residency. It's all about treating the symptoms. And treating symptoms means giving medications and putting a patch on the bigger problem and not dealing with the underlying issue.
Right.
So that's what the functional medicine approach is, where we are looking at the root cause of the problem and acting and helping from that approach. So that
Yeah.
young guy you saw on Monday morning,
Yeah.
People, these millennials, they know what to eat, but they don't know what is its impact and how does it work. And at some point, they also don't know like what is the right amount to eat and how to eat it. So
Yeah.
that's where we come in to tell them, okay, this is the protocol, because many people, they need a protocol. They need the proper document in their hand to see like, okay, this many ounces of protein I can take in the
Right.
morning. And it's not just any protein you're consuming, it's the lean protein, clean protein, organic food you're taking to help you reduce that toxic load in yourself, right? So
Well,
all those things are important.
yeah, and the nutrition, the messaging around nutrition has been so confusing, right? And
Yeah.
I think kind of intentionally so, because, eggs, for instance, perfect example, right? Eggs were vilified in the 80s and 90s. If you eat eggs, you're going to have a heart attack. And now, there's been,
Yeah.
and that was really just based on opinion. Actually, there were no randomized clinical trials and all these things. So that was
Mm-hmm.
just based on, well, cholesterol is bad. Eggs have a lot of cholesterol. Therefore, eggs must be bad, right? If A equals B, B equals C, then A equals C. But, we see that biological systems are complex, and you can't just have that linear kind of understanding. And in fact, now we've learned that, like in the example of eggs, for instance, the contribution of dietary cholesterol, I should say, to cardiovascular risk is not as high as we thought it was. And if you look at the beneficial compounds, the protein in eggs, it's a very complete source of protein, choline for brain health, vitamins, for replenishing micronutrients. It's actually it's a superfood, right? But
Yes.
every once in a while, the marketing takes place, a superfood, and people just kind of latch onto it. I remember, kale. By the way, I hate kale. I have you're talking about genetics. I have a SNP, a single nucleotide polymorphism, a genetic thing in my taste. It tastes like soap to me. So I don't know why anybody would ever eat kale. But that aside, like acai berries, right, were considered, a superfood, and, this and that. And there are these trends that happen as, the marketing machine kind of pushes one thing versus another. I mean, if you look at cauliflower, right? Cauliflower, riced cauliflower pizza, cauliflower's been around for centuries, right? You and I grew up on aloo and kind of, and all
Right.
these all these different kind of vegetables, so how is it they can have such a weird like hype cycle as
Right.
opposed to life cycle? So, I think even as a consumer who is health forward and health focused, it is really difficult to know kind of who to
Right.
trust, what are the right messages, what are maybe messages that aren't really based on things. And you and I are used to, in the kidney world and the heart world, certainly these huge randomized controlled trials of, like, 500, if not 5,000 patients. Let's give, 5,000 people cauliflower and 5,000 people not, and see what their outcomes are for their kidney and heart. And we just don't have that in this world,
Yeah.
right? So, I think one of the criticisms, I don't know if you face this, but I often face this from, the critics of functional medicine as well. You have no proof, you have no evidence, right?
Mm-hmm.
That this works. And yeah, I don't have a clinical trial telling you that broccoli is better to eat for your heart health than Skittles. So at a certain level, things just kind of have to make sense. And I
Right.
mean, the other difficulty from a literature standpoint is dietary trials are notoriously difficult to run, right? And
Mm-hmm.
so, that's where, the functional approach, whereas I think conventional medicine is this kind of one size fits all
Yeah.
approach. The functional medicine world is much more bespoke, right? It's a one size fits one.
Yeah.
And you really have to take into account, the individual, their lifestyle, right? Like diet soda is something that, one of my Instagram posts were about, was about 5 things I would never eat or never put in my body, one of which is diet soda.
Right.
I don't believe it's good for you. I think it probably screws up your microbiome and this, that, and the other. And somebody said, what's your evidence? And, honestly, there is evidence that people who drink diet soda actually gain more weight than people who drink regular soda for whatever reason. But if you're starting out drinking, and in Michigan, I practice where you are, so I know, probably not as changed, but I had people drinking, like, 64-ounce big gulp of regular soda
Yeah.
twice a day. Like, they would go to the gas
Can I
station and
can I share a story that reminds me? A patient came to me with acute kidney injury, and she was getting the whole case of soda every
drink.
day. And she's 60 when she came to me.
Wow.
So first thing I told her to quit soda.
Yeah.
Period. It doesn't matter if it is diet or it is your regular soda. Soda is bad. It's a chemical. It's full of phosphorus. It's created in a lab that should not be in our body.
Yeah.
Okay. So she quit soda on my saying that, and my prescription was quit
Yeah.
soda. You know,
And
and
what
then
were her
3 months
health
later,
outcomes?
3 months later, she came with normalized kidney function.
I mean,
Can you believe that?
it's not
I
rocket
mean,
science, but if, like, someone like that, for instance, she was very motivated to change. But if someone's drinking 64 ounces twice a day of regular sugar, and I'm trying to do the math, so it's 24 12-ounce cans, right?
yes,
So that's 144, 288 ounces of soda a day. That's a ton,
yes,
right? But
yes,
but but if someone's starting out drinking that much regular soda, then you know what? Yeah, from a calorie standpoint alone, switching to diet is going to be a less unhealthy option. I won't say healthier option, but less unhealthy option
Yeah.
than regular soda. But, these are questions that we have to ask. And, unfortunately, people think that diet soda is healthy, right? Whereas it's not. I mean, like I was a
Yeah.
diet soda addict. I don't know how you were in your residency and stuff, but you basically get through on caffeine. So I was a diet soda fiend. And eventually I had to kind of wean myself off.
Yeah.
And I actually had kidney stones, right? Your kind of specialty a few years ago. And I suspect that it was just a lot of diet soda, a lot of oxalates, but the
Right.
diet matters, right? Where eating matters. And we need to
Definitely.
convey that to patients. Yeah.
Definitely. So, what are the early signs of heart disease? If somebody has to be worried about heart disease, what would you suggest them to look for?
Yeah. So, the flippant answer is heart disease starts from when we're first born, right? So it's part of like the shot clock of humanity, and it just kind of exists as we start, growing up. And there are studies that show that even in the Korean War, these soldiers that passed away that had autopsy had evidence of early streaks of fatty plaques and things in their arteries. So, it really starts from when you're born. Early signs, the first thing I would say to everybody is, get your normal labs checked. If you're in a functional medicine doc, if you're seeing a functional cardiologist like me, we may do advanced lipid screening. We may do, other assessments. GAL3 is one that's coming out in both of our spaces, right? As a galectin-3, as a good biomarker of fibrosis and damage. But, so in terms of signs and symptoms, I think that the first thing I see generally is going to be fatigue, unexplained fatigue. Now, of course, fatigue can be a lot of different things. Maybe you're not sleeping well. Maybe you have sleep disordered breathing. Maybe you're just run down and tired and stressed all the time, right? But that would be one. And as we get kind of along the spectrum of atherosclerosis, that buildup of plaque and cholesterol, and really atherosclerosis is not the right term. It's really atheroscleritis because it's an inflammation of the blood
Inflammation.
vessels. It's a very inflammatory plaque. Then we start to get into more of the symptoms of restriction of activity, chest pain, heaviness. For men, I think, one of the earliest signs is loss of erectile function or sexual dysfunction, becomes a kind of a very noticeable thing for women. It's difficult because right around the time that you would be presenting with cardiovascular symptoms, generally speaking, is right around the time of kind of that premenopause, perimenopause period, right?
Hmm.
Like, it
Yeah.
takes some time for atherosclerotic plaques and things to build up. Remember, humans were not designed to live after 40, 45 years of age, right? We're supposed to, in the caveman times, we'd be long gone by then. So, we are outliving our body's capacity to exist. But vasomotor symptoms that for women, for flushes, these are all, signs potentially of cardiovascular dysfunction as well. So, I think, talking to your doctor, either functional or conventional, about, any symptoms that you're having, fatigue, brain fog, it's funny because I feel like the brain and the kidney are both windows to the heart, right? They're so
Right.
interrelated. So if you're feeling any of these symptoms, you're probably feeling all of these symptoms.
And there are actually all overlapping symptoms, right? Many of patients, they consider chest pain to be related to the heart issue. So when you would be really concerned about the chest pain, so how can you say if this is heart related or not? Is there any
Yeah.
differential you can
Yeah,
make?
when we talk about angina or discomfort related to the heart, I think chest pain is probably not the best word to use because people can have alternate symptoms and they'll say, "Oh, my shoulder hurts." That's not chest pain, right? So I kind of generally will say any funny sensation from the
Mhm.
nose to the pelvis, right, is something that you need to take seriously. So in men, that can be that heaviness on the chest, classically described elephant on my chest, sweats, cold sweat, arm to my chest, shoulder, this sort of thing. That's like the most classic. Even as an interventional cardiologist, I can tell you that as a heart attack specialist, I saw that classic presentation maybe 1 out of 5 people, maybe 20% of the time, right? A lot of
Mhm.
times it's indigestion, it's heartburn. I had one woman who it was a chronic toothache that she
Mhm.
had because she was referring pain up to her jaw.
Wow.
That's where I came up with that
Wow.
nose and below, right? But it can be nausea. For my father-in-law who ultimately needed a multivessel heart bypass surgery, it was acid reflux. He felt
Mhm.
acid reflux type discomfort without even eating, right? So that's why, any normal sensation between the nose and the pelvis, take seriously. And what does that mean? Well, have rapid evaluation. If it's something that is persisting, like you're just sitting there watching television and you're still having that discomfort, get to the ER. I can't tell you how, the emergency department, I can't tell you how many times people sat at home and just waited and ended up kind of killing off part of their heart tissue without proper evaluation. So your body well. Everybody knows their body. If something doesn't feel right, then get it evaluated.
Right.
Now, what are things that aren't cardiac related chest pain? Well, this happens to me all the time. As I mentioned, I like to lift weights a lot and I get a weird, funny sensation in my chest. And if you can push on it or touch it and incite the exact same discomfort, right, that is generally not going to be cardiac. If you take a deep breath in and that brings on the discomfort, that could be something serious, but that tends not to be cardiac in origin as well. But, this isn't something that's worth, going to Google or Chat GPT and saying, could this be my heart? If you're not sure, if you're worried, go in, get checked out.
Right. So when somebody comes to you with your functional medicine approach, what test would you order, or how would you integrate both conventional and functional into the practice to take care of those patients?
Yeah, perfect question. So, a lot of the testing that's done in cardiology is not really the test that needs to be done, right? And kind of what I mean by that is, we'll do an EKG in the office and people think, wow, an EKG is some great, thing. It really only is helpful if there's an ongoing issue kind of at that time, right? So if there's an electrolyte imbalance, if there's a arrhythmia, if there's any sort of insufficient blood flow to the heart, then an EKG is going to be helpful. Even stress testing, and I've talked about this before, is stress tests are not that helpful if you have non-obstructive disease, meaning, stress test is really geared towards finding if you have 70% or more blockage that can lead to insufficient blood flow at times of high demand, which leads to that sensation that we talked about of angina, that heaviness, that pressure, that shortness of breath, reflux, whatever it is. But for most of us, we're not going to have that degree of discomfort. So from a functional standpoint, we have to kind of put a different mindset on this, right? And look at this a little bit differently. So, the things that I do from a lab testing point is, number one, metabolic labs, right? Look at someone's hemoglobin A1C. Also, though, looking at their fasting insulin level, right? What people don't realize, and I call this the grandmother issue. My grandma was losing her hearing, right? And so we had to go next to her ear, like literally, and yell, and then she could understand us, right? Mm-hmm. But the volume had to be so loud for her to get that same input to her brain. Well, similarly, when we talk about metabolic health and insulin resistance, your insulin level might be okay, your your sugar level may be okay, and you can speak to this as well. Your glycosylated hemoglobin, which is something that we use as a metric of the last 90 days of your blood sugar, may be okay. But if it takes 5 times the amount of insulin to get that normal level of sugar, well, then that's an insulin resistance process happening. So that's a little bit different from the way that I think conventional medicine looks at this. Advanced lipid testing. So it's not just the good and the bad and triglycerides in terms of cholesterol, but you have to look down more specifically, more granular at what are the types of good cholesterol that you have? What are the types of bad cholesterol that you have? Because some are less functional than others, meaning some are less beneficial than others. Some are more atherogenic. So on the LDL side, low density lipoprotein, people know this as the bad cholesterol, right? Mm-hmm. But there are actually 5 subtypes of LDL, and we only know kind of LDL, but there's also very low density, VLDL, intermediate density, kind of all of these different things. And what you want to look for is, how big or small are the LDL particles that are circulating? Because the large particles, I call those the big and bouncies, they're not going to get in your blood vessel wall and infiltrate. They're not heavily inflamed, so they're not going to incite an immune reaction to be taken in by cells to get taken into the blood vessels. Whereas if you have a lot of small, dense LDL, that tends to be the damaged LDL, the oxidized LDL particles. Those are ones that get grabbed and taken into the blood vessel in an adaptive response to try and protect you from them. But that's what causes plaque. That's what causes atherosclerosis. And I know it's kind of nerdy, but on the flip side, HDL also has subtypes as well. So I remember, not that long ago, maybe 10, 15 years ago in the cardiology world, we would say, oh, well, if you have a LDL over the age of, or over, 75 milligrams per deciliter or 65 milligrams, you're protected for life. You're great. But now we've learned that there are different types of HDL. Some are more helpful than others. And there's now data that shows, right, and one of the most well-studied areas of functional medicine is probably lipidology, but there's data that shows that people that have a really elevated HDL tend to have inactive or less active HDL particles. So they're actually at a higher risk of cardiovascular events than we thought.
Right.
Good question.
Conventional
Yeah.
medicine, as you touched upon, like the testing they're doing, which I used to do at some point in my office, and probably you did too, is very, very superficial, and it's not giving the whole picture
Right.
of, as you said, different sizes of LDL is important, HDL is important, how they impact and how they increases the risk of heart disease is important. So that is where you would start with the lab testing, biomarker testing. What do you think in genetics, like what role genetics play in heart disease?
Yeah, so I was actually just recently appointed as the director of precision medicine for for the American Board of Precision Medicine. So that in that capacity, we're really looking at genomics and more so than the genes that you have, but how those genes function. You mentioned kind of at the outset that your lifestyle, your diet can affect your genetics, right? So if you make a bunch of good choices, right, we have this thing called epigenetic changes where you can actually turn on better genes. If you have, poor lifestyle choices, then you turn on the bad genes, right? And so, how do we interplay that? But even more so, what is actually happening in your body right now? Do you have a lot of inflammatory proteins that are going around? We think, in the cancer world, they've done a really good job of this. They have biomarkers for cancer that you can screen for, right? You've got CA-125 and kind of all these markers that may be elevated in certain cancers. Well, now we're seeing that there are certain proteins that are associated with these bad genetic atherosclerotic kind of types. And so, and oftentimes they'll precede clinical issues by years, if not decades. So now, you can get in and take a look. So, I think the role of genetics is expanding, quite significantly. And now the processing power and the turnaround time is relatively quick enough that we can use this in a meaningful way. Just getting back to testing, there was one thing that I wanted to mention as well. So there's the biomarkers, there's lipids, there's metabolic labs, but there's also imaging that I think is super important that we need to talk about, because like the conventional stress testing, like I said, really is geared towards finding blockages in arteries that are affecting blood flow. But there are other tests that are able to now show us kind of with a little bit more accuracy and precision what's going on right now. A lot of people have probably had become very familiar with something called a coronary calcium score, which is a very low-level CAT scan, meaning low X-ray dose of a CT scan that looks for calcification in the arteries. And that's, was a very impactful test at the time when it came out because it gave us an idea of risk stratification of an individual, right? Now there are these AI-assisted tests that can actually look not only for calcium, but also soft plaque. Right. So, it's an enhanced CT angiogram scan. There's a little bit, there's definitely more X-ray dose, but it's a lot more profound information that we give people to really change, their lifestyle and habits. So, I think the technologies are getting better and better and are really helping us get a better understanding of, from an individual standpoint, how do I assess your risk? Rather than just putting you on medicines. I'm not saying medicines are evil and we should never use them, but are there lifestyle things that we can do? Because now, instead of waiting until the car accident has happened, right, we can kind of steer to the left and avoid the pothole or whatever, and avoid the accident in the first place. And that's really the powerful thing of kind of what you and I do, is steering people away from the train wreck of the disease that they are on this path towards, right? And early intervention, and really guiding them through diet, lifestyle, sleep, stress, kind of all these different things to avoid disease in the first place.
Yeah, I have seen in my practice the biggest challenge the patients have is that all these testing which we are doing, including the genetics, is not covered by the insurance companies.
Yeah.
And the major pushback is coming from insurance coverage. So how do we navigate through that is something we need to figure out. I would be curious to know what practices you are doing to navigate through it and help your patients.
Yeah. So, I think I benefit from from my subspecialty because lipid testing is, generally going to be well covered, right? Advanced lipid testing sometimes not. And so I have that discussion with patients. Now, one of the benefits of advanced lipid testing is you get an idea of particle size, atherogenicity, all these things. One of the things that I did not mention that you can test is apolipoprotein B, or ApoB, which is generally going to be a relatively inexpensive study. It doesn't give you the entire breakdown in detail, but apolipoprotein B is a cell surface marker on what are called atherogenic lipids, right? So those are the ones that don't cause plaque. So if you can't afford or get coverage for the advanced testing, ApoB is something really easy to do. The other answer to that question is, as functional medicine physicians, we, I think, have to be much more intentional about what are the tests that we order, right? Because,
Right.
I think that, we get so excited about stool mapping and, epigenetic testing and SNP testing. And in fact, I had my genomic sequence done and it was almost, it was upwards of $2,000. Now I paid cash for that, but, it's difficult for me to ask a patient to do that. I just wasn't nerdy enough to have an interest. So, that's where, I think I probably differ from a lot of functional medicine practitioners is I actually don't rely heavily on supplements because as we talk about the cost of functional medicine, not only are the cost of testing something that we have to worry about, but the cost of supplements. And you've probably seen this as well. People will come with like a huge crate of supplements that they're
Right.
taking. And you're like, oh my gosh, like, we worry about polypharmacy in the conventional world. Well, we have to worry about that in our world as well, right? Oh
Right.
my gosh, like, are you taking 3 supplements with all the same things in some way and getting a toxic dose, right? So we really have to be intentional about supplementation as well. So, for me, of course, changed the scope of my practice. I'm no longer dealing with acute heart attack patients because for me to tell someone who is having a heart attack, oh, you should probably eat more Brussels sprouts. That is not the right. That's not
Right.
the right thing to do. But going towards more of this kind of like a secondary prevention. They've already had a cardiac event. Now we want to prevent the next one from happening or not having one in the first place. There I think we have a little bit more latitude to not necessarily rely on testing because, you can, we've been doing this for years. I can already tell when someone's out of balance, right? You don't need a
Right.
test. I don't need a test to tell me that you're stressed out. I don't need a test to tell me that your microbiome is probably screwed up. I may not even need a test to know that you're inflamed if I look in your mouth and your gums are a hot mess and all these things, right? So, I think being intentional and kind of being much more targeted in terms of the testing that we do is helpful. Now, there are some people and that are really complex, and I suspect that, in the kidney world, that's going to be much, a much bigger thing than the heart, because I think renal patients are exceptionally complex,
Right.
right? So, we have to balance, but part of that is, something can't be expensive and valuable at the same time, right? It doesn't,
Mhm.
if you really push value, if you really kind of value something, no matter what it costs you, you're not going to feel that it's expensive,
Yeah,
right?
my patients, this is the investment in your health, right? So
Yeah,
you invest now to prevent those preventable diseases, chronic diseases from happening, which you would be spending thousands of dollars later on when you're
yeah,
unhealthy and it's already too late. So
yeah,
this is the time to wake up and invest in your health. And I think that is the approach I'm taking in my practice. And of course, you have to be intentional about what you're testing. But if somebody is coming in with weird signs and symptoms, you have to test for toxins and heavy metals, which is
yeah,
very commonly seen in this world now. Everything pretty much we are consuming has toxins in it, including the food we are
yeah,
eating full of pesticides. So I think the intentional approach, and as well as, being upfront with the
right,
patients, telling them, okay, this is your out of pocket cost,
right.
but this is the investment in your own health, and this is going to help you later on. So I think that is, they have to be open minded about it. Now, what are the biggest lifestyle changes you would recommend for having the bigger impact on the heart
Yeah.
health? If somebody already has a heart disease or they are approaching to those, fearful signs and symptoms, what would you recommend to them?
Well, if they're already having signs and symptoms, then, I think a conventional evaluation is required, right? So I'll just kind of put that out there. But for that asymptomatic patient that, doesn't want to develop problems down the road, I run a program. I know, we've talked about that before, but my program focuses on kind of 3 pillars: diet, stress, and sleep, right? And diet, really kind of focusing on a functional medicine, anti-inflammatory diet, get a lot of the preservatives, as you mentioned, out. It's difficult because, like for instance, in cardiology, we tell people eat more fish, but now they've got mercury issues because they're eating so much fish, right? So you have to be kind of smart about this and do it with an intention. But I think the things that the two, that's the stress optimization and sleep optimization are really two of the things that a lot of people just don't do, right? Because it's so easy to just stay up and watch that extra show on Netflix. In fact, last night I was watching one of my favorite shows. I'm like, you know what? I'll just watch another episode. No big deal, because I knew this morning, which is Sunday morning when or Sunday afternoon when we're filming, I didn't have anything to do, but I still woke up on time, and I was a little bit early. I had a little bit groggy this morning when I woke up. But, if you're doing that consistently and
Yeah.
eating into your sleep and not being intentional about your sleep, well, then you're not going to do well, right? I think of that story of the original marathon, right? They won the Battle of Marathon, and they sent a soldier to run 26 miles back to the capital to tell the king that they had won. He ran, and then gave his message, and then what? He died, right? Because there was no rest in between, right? Or those old Western movies where they run a horse forever and the horse just dies, right? We need rest.
Right.
That's rest is when growth happens, right? So we really need to prioritize sleep. And then stress, like I don't think comprehend, right, how much stress we put ourselves under, right? Like my family in India, for instance, right? Like these dudes just sit around all day forever. It's like a lion at a zoo, right? They're watching movies and they're doing this and they're all retired and they're just existing. And it seems like, to our mindset, it's like, well, what did you accomplish today, right? Well, they lived, right? Like that's what they did, and so the multitasking and the this and the phone calls and the emails and the kids and the parents and the, like we just get so addicted to stress, and it's a cortisol addiction almost, that when our lives are going well, I don't know if you've ever had this, but let's say a really good day happens, and then I'm always like, all right, something bad is going to happen. Like this doesn't feel normal to me, right? Like what tragedy is going to descend upon us, right? Like because you're so used to putting out fires all the time. And
Right.
then even worse is if you don't have your own drama, there's a whole genre of television that gives you somebody else's drama to watch, right? So we just feed into this
Right.
cortisol, this stress addiction without realizing. And so what we need to do is at least number one, start with that awareness of my stress addiction, right? And number two, then kind of find things to substitute in, right? Like exercise or going out for a walk or being with your kids, being
Yeah.
with your spouse, just existing. We need to focus on a lot more.
Yeah, I think it's a big thing because, we are living in a stressful life and this has become norm. And many people don't realize that they are under stress because they take it as a normal lifestyle,
Right.
which is completely not normal. And being mindful about it, taking some breaks, sometimes I tell myself because I'm sitting for long hours and I tell myself to take intentionally those breaks and put some alarms in the computer or on my phone. I think that helps me break that pattern, So the movement, the mindfulness, and having a good sleep, of
Yeah.
course, is very, very important. So thank you so much for sharing all these nuggets. We had a lot of fun.
Sure.
I'm sure the audience have learned a lot from this discussion, and I really appreciate your time.
Thanks for having me, and thank you for sharing that with me.
Of course. See you soon.
All
Take
right.
care.
Take care. Bye.
Bye-bye.